Hello, this is Lauren, speech language pathologist, coming to you about what to look for as you are working with different therapists. It is a big world out there of therapists that will work well with your child, that won't, ABA therapists that may not be helping your child as much as you think, or ABA therapists that are very good with your child. And the biggest difference is not what you're doing, but how you're doing it. Here are a list of things that I think are really important when you're dealing with how. One, you have to have a positive belief. If you ever work with a professional that tells you your child will never talk, will never walk, will never have friends, stop. Don't work with them anymore. They don't have a very positive belief unless they are a medical doctor who are telling you a medically certain result. The second one is they have to look through an empathetic lens as opposed to just ticking off behaviors. So if you're working with a therapist who will say, little Johnny is hitting others and he is trying to be manipulative and he's trying to get what he wants, he cries just to get away with things, and they stop there and they don't look at the empathetic reason for it. Little Johnny is trying the best he can to get his wants and needs met. He just doesn't know that there's a better way, right? Or that little Johnny would do it if he could. He would talk if he could, but right now he can't. And this is such an interesting concept because maybe yesterday little Johnny said apple for the apple, but today he's not. And I think a lot of professionals start saying, he just doesn't want to say apple. Well, let me tell you this. Kids do what they can. Period. And I read this in a book and I love this sentence, that kids do what they can. Most of the time these kiddos on the spectrum can't do it right now. Maybe they can in 10 minutes. Maybe they can tomorrow. And maybe they could yesterday, but maybe they can't right now. I find a lot of kids on the spectrum have a lot of difficulty transitioning from what they were thinking about to what you're asking them. The third item to look for when you're working with other therapists is goal setting. It's very easy to set a goal that is not actually appropriate for that child. You may have a goal that is so far from what they're able to do that you end up shutting that kid down. And that happens a lot when you're working on sounds. It happens when you're working on those first words. And it definitely happens when you're working on communication as a whole, because there are building blocks to what a child is able to do. You don't want to set a goal that will make it so that the child gives up. So if in the apple example, if the child is looking and they've maybe never said apple, but they know you're going to want them to do something they've never done before in a way that puts pressure on them, then of course they're going to avoid it. And they might start having behaviors that are in response to this. So we don't want to just look at the behaviors of a child. And I find a lot of therapists will just go, okay, we need to solve the hitting problem. We need to solve the running away problem. But really you have to solve the reason why the child is even thinking of doing these things. And some therapists do that really well. And some are more interested in what they see right in front of their eyes without doing a little bit of detective work. So I'm encouraging parents to please be your own child's detective and looking for therapists that are willing to look at the big picture. This has been Lauren Conley, and please leave comments below.